Here we're going to show you some skin rolling techniques. Skin rolling is used for a couple of reasons. It could be used as a treatment, so you're treating the superficial fascia. It can also be used as an assessment. So Hilton's law suggests if indeed you find hypersensitivity in the skin, that would suggest that there could be an underlying problem with the joint below the skin and or the muscles below the skin. So for example, if I pinch Kiki's skin here and she's like, ow, that hurts, that could suggest there's a problem in like T11, T12, or that could suggest there's a problem in the muscles. That's why we can use it as an assessment. Couple of ways of skin rolling. I don't barely use any cream, just a tiny bit of cream on the fingers, literally. So if you can see that on camera, this much, and that cream goes on me as opposed to on them. So my hand's just a little bit moist. So I grab, or I start at the spinous processes with my thumbs. I pinch the skin and I wave out. See, I'm creating this wave towards the waist. Here. And you come back and go one segment higher. I pinch and roll. So there's a response there. So I would either make a dot on her skin using a soluble based pen marker, just to put a dot here that there was something going on. There was a big groan. I don't know if you heard that on camera. So there's something going on in this piece of skin. So we can treat this skin. We go around to the waist. So there's something going on this whole line. She's tensing her body. I move up one segment. We go down again. Not so bad here, right? So there's an obvious difference between 1, 2, and 3. These two areas wasn't so bad. This area definitely elicited some sort of pain response. We'll keep working our way up. So again, something going on here, big response. And I'm using a very light pressure here, guys. Just enough to create this wave here. So again, I would make a note here. We can work all the way up. And I'm going to show you some techniques on the neck as well. So here we're working from medial to lateral. We can grab the outer waist and roll backwards this way. So I start lateral, create that wave, and I'm just walking myself back. Yeah, same thing, same spot. Grab, pinch, wave, wave, wave. As with regular massage strokes as well, you don't only want to work in straight lines. So I would work from the top of the lumbar spine down to the iliac crest. So we're really going across that quadratus lumborum. So I'm going to pinch here. And I'm going to roll down towards the hip. Here. And when I'm doing this work, I'm very close to the table. My legs are bent and I'm trying to use my body as efficiently as possible. So now I'm going to go from L4, L5 up towards those lower ribs at a slight angle. So when we do incur these real hot spots, the treatment could be just come across, find, and just hold. So all I'm doing here, guys, I'm just teasing the skin away. We're trying to separate those fascial layers. Whenever you're working the skin, you are indeed working the superficial fascial layer. They're inseparable. Whenever I'm using one hand, a one-handed technique, the other hand I always place on the body or on my hand. It just gives a bit of comfort to the client. If you've only got one hand on them, it just feels a bit odd, like it's lack of connection. So although I'm not really using this hand per se, I will place it here. You can change. So in order to cause a different type of release, a quicker release possibly, I will skin roll and I'll push away. So I'm creating some traction in the skin. Same here, push away. So I'm just creating a bit of torque in the skin. So here we went from medial to lateral, lateral to medial, and we've got these oblique lines. We can skin roll and bias. Skin roll, and see I'm torquing the skin. Skin roll, torque. Skin roll, torque. Skin roll, torque. So Kiki doesn't like this. And by the way, Kiki doesn't like skin rolling, full stop, by the way. Some clients, I call it the Marmite of techniques. Marmite, what do Americans call it? Vegemite? In England we have a commercial called the Marmite, and their strapline is, you either love it or you hate it. And I think this technique is clients either love it or they hate it, and Kiki's a hater. So yeah, get here. But another good reason for using the skin rolling as an assessment. So let's say Kiki comes in with a lower back pain, and we just skin roll. It's like, ow, it hurts there, and that's when my back hurts. We can explain to her these neurological principles of Hilton law that if the skin is pain generating, the muscles underlying that skin and or the joint and or both are normally hypertonic or tight, or there's some sort of dysfunction in there. So it really gets the client to really believe in what we're doing. They're like, wow, you just grabbed my skin and it killed me and it hurt me where I hurt. So it's just a way of getting their buy-in from a holistic point of view. So skin rolling, of course, can be used on the back, but it can be used anywhere, guys. I use it on the shoulder blades a lot. So I'll frame the shoulder blade, inferior angle, superior angle, spine. So here we frame the scapula, and I'll just roll across the joint, across the bone, sorry, towards the tricep. Repeat, like we did on lower back, medial. I'll show you on this side. So if I'm going in to out, I can just as easy go this way. This way. Crazy stuff. Is that really that soft?
Yes.
This is barely any pressure. So this suggests to me there's going to be something going on in this sort of like teres, infraspinatus. So I'd make a note of that, and this is something that we need to treat and assess, because it shouldn't be that sore really, especially with this very light pressure. But anyway, back to skin rolling. The neck, we use a lot of skin rolling on the neck. And the way I like to do it is I like to work the nuchal ligament, this big ligamentous tissue here. Due to postural issues, postural demands on us, this nuchal ligament tends to become very short, very tight, and it affects our ability to flex our neck. If you ever seen any of our assessment seminars, our assessment courses, we talk about the importance of being able to flex the neck, chin to chest. Limitations in that movement are sometimes due to the nuchal ligament. So the way we skin roll here is we just grab, this is tight, Kiki, and we just lift. I'm going to use one hand for camera purposes. I normally use two. So I grab and we lift. Very relaxing. Once you get them calm, it's like, if you've ever seen a cat pick up a baby cat, they pick it up by the neck and the cat goes limp. It elicits that sort of like rest and restore parasympathetic response. So skin rolling of the neck. Same thing like we did on the lower back. You roll laterally. Again, I'm gonna do it with one hand. Make that wave and you just roll, roll, roll. Feels okay? Here. Should try to create this wave-like motion. And this can become more therapeutic in the neck and in the back. If you are working on a real life client, so let's say Kiki was a real life client, I've only seen her once or twice before, don't really know her so well, and I skin roll here and we get that real pain response, I won't freak out and stop, but I will greatly reduce my pressure. We don't want the clients jumping around the table because of pain, right? So let's say, so I'm working Kiki's shoulder and she's a real pain response here. I'll release my tension and finish. And then I might come back, do a really light roll, and here. So I really, the worst thing to do, guys, is you're here, they go, ow, and oh, sorry, like, never do that, because that really diminishes our trust. If we start panicking, if we have a panicky motion, the client starts thinking, uh-oh. So all the time, whenever I find a hot spot and they say, ow, that really hurts, I'll stay there, reduce my pressure, and just work through it. So get into skin rolling. Like I said, can be used anywhere on the body. Just the back is the easiest to show you, easiest to teach, and the skin is generally very pliable. Some clients, due to health issues, lymph drainage type issues, body fat issues, you aren't going to be able to manipulate the skin as easy as you can on Kiki. That's okay, it's just you just work with what you have. You may have to use a different hand configuration. You can use like hands like so on bigger clients. This type of skin-based technique. Some clients' skin is it just doesn't have any elasticity. And that's generally a sign of poor hydration, possibly high body fat, some sort of like toxic response in the body. And we try and educate our clients. The skin should be somewhat pliable, it should be somewhat soft, it should be somewhat oily but not greasy, it shouldn't be too dry. So the skin tells us a lot about the general health of a client. The skin actually makes up 16% of the body weight of the body, so it's a very large organ and it should be treated accordingly in our opinions. So skin rolling, but use it cautiously. Some clients will love it, some clients will hate it, but it's worth adding into your toolbox.